Moving on, the Palestinian Authority now rejecting the delivery of over 1 million coronavirus vaccines from Israel. And this after just receiving the first shipment of roughly 100,000 doses. Palestinian officials claiming to have been duped because the vaccines are set to expire at the end of June and then later at the end of July. The Palestinian Authority even now demanding an investigation into what they're calling the vaccine scandal. But Israel is insisting that the doses are perfectly sound, identical to those given to Israelis, and that anyways, the Palestinian Authority knew full well about the pending expiration dates. In fact, officials earlier announced that this was kind of the point. According to the agreement reached with Pfizer's involvement, Israel would provide over 1 million vaccines to the Palestinian Authority and in return receive the PA's shipment of Pfizer vaccines, which are scheduled to arrive in September. This way, Palestinians could get vaccinated sooner and Israel could restore its stocks at a later date. So why cancel the deal? Well, joining me to discuss is CEO of Honestreporting, Daniel Pomerantz, and on Zoom, Professor Nadav Davidovitch, Director of the School of Public Health at Ben-Gurion University and Interim Chair for the Association of Public Health Physicians. Thank you both so much for joining me. Now, Professor Davidovitch, I'm actually going to start with you. Is there anything wrong with the vaccine if it's nearing its expiration date? Is it less effective? Does it last less?
No, there are also options to extend. Of course, when you get the approval of the pharmaceutical experts, including Pfizer. But I think there is something much deeper here. All the public health community, including myself, we signed a position paper already beginning of February that it's Israel interest to bring the Palestinians vaccinations. Of course, not just because of our interest, but also because of human rights and humanitarian aspects. And already from the beginning of February, there are negotiations to do this kind of deal that finally was approved last week. I know for sure that the Director General of the Ministry of Health, Professor Chazi Levy, was involved, Dr. Sharon Al-Roi, the Director of Public Health Services. And because of the political atmosphere or lack of, focus of attention, the thing was delayed and delayed. Last Monday, there was a Supreme Court decision to delay the whole issue up until October. And many human rights organizations like Physicians for Human Rights, sent a letter to the new Minister of Health, Nitzan Horowitz. And I need to say that both Nitzan Horowitz and the Prime Minister Bennett approved it quite quickly, but now this was already more than 2 months later, and bringing the situation that the vaccines, some part of it at least, are very close to expiration because there is no trust, enough trust between Palestinians and Israel. This created, this whole situation with internal disputes. I think this is just showing us that with more attention, this whole issue could be solved 2 months ago and save lives. And this is, again, according to all public health experts in Israel.
So, Professor, theoretically speaking, because I know that in Israel, within the first 2 weeks of the vaccination campaign, we vaccinated roughly 1.5 million people. Could the Palestinian Authority have theoretically or logistically used the vaccines that Israel was providing them, even though the plan was delayed?
Theoretically, yes, but I think that the whole context of having this deal approved almost last minute, with criticism within the Palestinian society and the lack of trust, again, between all parties, the fact that there is all secrecy about how many vaccines are in Israel, and all the idea of vaccine nationalism, instead of creating more regional approaches, I think it created an atmosphere that was not, exactly the best to move forward. I really hope that the Palestinians will be going to use the vaccines because I think can save lives. I regret that Israel didn't gave the Palestinians the vaccines already 2 months ago.
Okay, so Daniel, first of all, Professor, thank you so much. Daniel, I want to turn to you now. Walk me through what's happening because, again, the decision, at least from what I can tell, comes after a very long chronology of propaganda and twists and turns. I mean, the timeline I have is that the Palestinian Authority initially firmly states that it neither wants nor needs Israel's help in getting vaccines. Israel's then blamed for not helping in the West. The Palestinian Authority jumps on that bandwagon. Then Israel is now offering to help. The PA agreed and now canceled it at the last second, alleging a scandal. Am I missing something?
Well, you're right on point, actually. The Palestinian Authority government has been turning down Israeli help since December. So this idea that had Israel come to an internal agreement 2 months earlier, all of this would have been done 2 months ago is nothing less than absolutely naive. The Palestinian Authority has the right under international law to accept or refuse aid. Israel has the obligation to respect the Palestinian government's autonomy. Now, this has absolutely nothing to do with expiration dates. On our staff, one of our editors, Kiva van Koningswald, working with our managing editor, Charles Bibelser, revealed that just last Friday, the Palestinian Ministry of Health announced that it has the capacity to vaccinate at the pace of 80,000 shots per day. That means that the full 1.4 million doses that Israel is offering could be administered in 17 and a half days, well before the expiration date, which is 6 weeks from now. But that wasn't the reason at all. Khaled Abu Toameh, a Palestinian-Israeli journalist, wrote this morning in the Jerusalem Post that when the Palestinian government announced this deal, you'd think Palestinian people would be happy. The Palestinian street exploded with objection. They said it was a scandal. They said it was normalizing the occupation, which is a phrase that refers to recognizing Israel's existence at all. And they demanded that the Palestinian Authority back off of this deal, which is exactly what the Palestinian Authority
Could the Palestinian Authority have not explained that receiving vaccines from Israel doesn't normalize anything, really? Or does it?
Well, it does, because it shows that the Palestinian government is interacting with what they refer to as the Zionist entity.
Well, they do that anyway with security control and certain administrative governance.
They try to do it in a way that isn't terribly public. They try to hide that as much as possible so that people don't realize that it's happening. It's very hard to avoid the knowledge that it's happening. It's being done both with Israel and through Pfizer. It's a major international deal. And for the better part of a year, the Palestinian government has been telling Palestinian people that any medical help that comes from Israel is poison and is designed to harm Palestinian people. So if that's the information that you have, it wouldn't be surprising or even unreasonable to be a little suspicious of help coming from Israel, which your own government has been telling you up until now could potentially be poisonous.
So let's leave the Palestinian Authority now. Is mainstream media in the West or voices online, especially in social media, especially given the recent history, have they been picking up on this narrative that the Palestinian Authority is pushing, or are they maybe seeing through it, or is it?
Well, for the past 6 months, ever since the vaccination drive started, what we've heard in the mainstream media is all these claims about vaccine apartheid and that Israel won't give Palestinians vaccines, when in fact the Palestinian government was denying those vaccines. The discussion today is that Israel gave the Palestinians vaccines that were nearing expiration without explaining what that means. If the vaccines are going to expire something like 5 weeks after they can all be completely used, that's not nearing expiration. That's like saying a baby is nearing old age because every day that baby's closer to old age, but it doesn't mean that baby's actually close. These vaccines are nearing expiration, but it doesn't mean they're near.
All right, Professor Davidovitch, I want to turn to you for one last time. If maybe, based on what you just heard from Daniel, if you'd like to add to that, and especially with respect to the role.
I think this was a very simplistic description. I'm in touch with my colleagues. I totally agree that there are parts within the Palestinian Authority, and especially Hamas, that really wanted it to fail. I need to say that many Palestinian public health workers really want to have collaboration with Israel. I totally agree that many times it's very difficult because of the political context. And again, I do think that if the current government was there several months ago, things would be different. Still, there'd be probably criticism by some parts of Palestinians. And I'm happy that the current Minister of Health, Nitzan Horowitz, and the Minister of Health and Palestinian Authority, they spoke Friday. I think that health can be a bridge for peace. I think indeed it's very difficult, but that's something that we need to do because it's our interest. Ahead of us, very difficult challenges such as climate change and other things. We had in the past roundtables with the Palestinians about infectious diseases. We are working with them. It is true that there are forces that were described, rightly so, but this is not all the Palestinian society. We need to find those who are willing to collaborate and strengthen them. And I wish this could be done as early as possible.
All right, well, I think we can all agree that we hope some sort of collaboration, some sort of cooperation can be reached. Professor Nadav Davidovitch, Daniel Pomerantz, thank you both so much for joining us today.
Thank you, Aaron.
Thank you.